Alright, so once again, talking about the adductor magnus. So the adductor magnus is considered to be part of the hamstrings, and some, I guess, consider it to be part of the groin, being as it runs along the inside of your thigh. There's not a lot of injuries that happen to it other than a strain, so that is the most common injury. It's most common in soccer players and hockey players, but it's also possible to occur in football, basketball, tennis, baseball, softball, and figure skating athletes. The most common causes are sudden movements to the side, like pivoting, and sometimes even the start and stop of sprinting. Forceful movements to the side and improper stretching also contribute to an adductor strain, so really to any of the adductors. Fatigue and muscle weakness can also play a factor. Risks also increase when you have hip problems, so like any hip replacements or like a tilted pelvis or something like that, you're more at risk for a strain to one of your adductors. Treatment would involve icing, NSAIDs, and activity modification. Sometimes that includes crutches and being off of it for a little while, but that's usually when it's really severe. Stretching and gentle strengthening exercises can help with the recovery process. The strain will start to feel better after a couple of weeks, depending on how severe it was, but it could also take up to 6 months if the symptoms don't seem to subside and like they go away, but then they come back. It just kind of depends on how well you take care of it. So proper prevention of this injury would include a proper warm-up and not returning to sport activity too soon after a previous injury. So if you had injured it before, strained it before, and you go back too soon, you're more at risk to re-injure that area.